they are.
I received a lot of comments requesting to check out the series Robot Chicken from actor Seth Green. Now, Seth Green actually voices Chris Griffin on Family Guy. So considering we're huge fans of Family Guy on this channel, I'm excited to check it out. It should be pretty funny. But for those of you who don't know, this series parodies pop culture using stop motion animation of toys. We really don't see stop motion animation much anymore, so this will be a first on the channel. But before I get into it, if you are new to my channel, welcome. My name is Dr. Jordan Wagner. I'm an ER doctor. If you enjoy the educational reaction videos and other stuff that you see on this channel, please smash that subscribe button and turn the bell notifications on. That way you learn when I post a new video. All right, let's dive right in.
This will only hurt for a second.
What the? Oh, right in the eye. So if you puncture the eye, that's very dangerous. Thank gosh now we have new type of liquid that you can put in the eye if it actually leaks out. But then you have a very thin wall of bone behind the eye. So the question is, could it go through and into the through the window? Oh my God.
And that's what'll happen if you flinch.
Wow, what a story to tell your patient so they remain still. A lot of times what I'll actually tell a patient, push into the table or push into the bed in a direction where it's safe for both of us versus movement side to side versus down.
Oh no, Arthur, this shot doesn't go in your arm, it goes in the tip of your penis.
What? The only time I've ever put a needle inside of a penis is if the patient comes in with something called priapism. Priapism is a prolonged erection that then is life-threatening to the penis itself.
I totally forgot about the diagnosis. Emphysema. What you have is emphysema.
Pink Panther has emphysema. Very common in somebody who's smoking, and emphysema basically has to do with losing lung tissue due to the fact that you've been smoking.
Remember this? Hey, Fred, you need a light for that smoke with the
Oh my gosh.
flavor?
Do I ever?
Flintstones and smoking. I remember they used to have it where doctors would even smoke. The brands of the tobacco companies were trying to get it out there for people that say, oh no, it's actually healthy, good for you, it's a cool thing to do. No. Here's your quick PSA. Don't smoke. Not even if the Flintstones tell you it's cool. No.
No. Jesus Christ.
That's messed up. Yabba dabba depressing. I love it. Fred Flintstone is now having some sort of laryngeal issue relating to his voice box, and now he has to have an amplifier of the vibration of his vocal cords so you can actually hear what he's trying to say.
That I, Count Dracula, have arrived.
Do you have an appointment?
Dracula was a walk-in patient and Rosenwitz was super booked. But the other doctor named something Asian had a spot at 3, so we take a look.
Fortunately, it's really hard to keep a schedule on time. You know, people have medical issues and you get stuck talking to different patients about different things. There could be like end-of-life conversations. They're not doing it on purpose. And the old adage, if it is an emergency or very urgent, you can either go to an urgent care or to the emergency department and visit your friendly YouTube doctor.
Nurse, what was his blood pressure?
0/0.
Okay, that's pretty low. I'd like to see that up around 120/80 next time. So stand up and let's check those testicles.
Oh my gosh. What are you looking at his testicles for? A grown adult, not having any complaints. This is supposed to be a focused physical exam, not just a general one. And typically when a doctor is looking at the genitalia, they're looking for hernias and just make sure the anatomy looks fine. I don't know what he's doing here, so let's see if he's doing a hernia check.
Oh, God.
Those are hanging a little low.
Well, I am 900 years old. Blah, blah.
Over time, gravity pulls on your skin and so it could drop down. It happens. We don't really tighten up the scrotum, so to speak. Again, I don't know why he wanted to look at his testicles.
Well, it wasn't strep, it was acid reflux. He didn't need a Z-Pack at all.
Dracula had reflux. So what do they mean by reflux? Gastroesophageal reflux disease, or GERD, is basically when you have stomach acid going into your esophagus and it's burning and it can actually go all the way up into your throat and cause throat discomfort and a sore throat. Now, if you do have that, you can take medications over the counter like Pepcid or omeprazole.
Now here's another look at Dracula's balls.
Here they are.
What are they thinking? Like, I don't even know what that looked like. It looked like a weird, fleshy, white thing that just dropped from underneath. If somebody's scrotum hits the floor, we have a major problem, and I will send you to one of my friends who's a urologist, and he will fix you up. No problem.
Well, one day I swung over the swing set bars and through an ill-defined chain of events became Inside Out Boy.
More like geek.
What? So cool. Inside Out Boy. I love it. Inside Out Boy, I think is like some old cartoon, but I'm old enough to not even know what Inside Out Boy is. It looks really cool from an anatomical perspective.
Cheryl, you should write for BoJack.
Yeah, I should.
Aww.
Don't listen to them. Your differences are what make you special.
Oh, nice. You can see the heart beating. And obviously you have the ribs that actually protect the whole rib cage, and you have a sternum that goes over top. But they did a really good job, pretty much. Looks like he's missing his fibulas. Yeah, but it does look like on the forearms he does have 2 bones, which is accurate. So it's good.
Don't worry about that. When I get an erection, my penis goes inward. But you're right. I'm awesome because I'm Inside Out Boy.
Erections, one, don't go inward. Okay, erections go outward. I guess it makes sense, right? He's inside out, so then it would go the other direction.
You're welcome, but don't lead with that any erection thing.
Sometimes when you're at a party and you maybe had a little bit of alcohol, you say things that maybe you shouldn't say. Maybe keep to yourself.
Ready for our first patient, Doc?
Oh, cover your mouth. Pediatric patients are known to just cough, sneeze, lick, eat, bite. We understand that, so we have to protect ourselves wearing a mask.
I'd say he has a cold, Mom. You're right, Doc. What do you recommend? Plenty of rest and some chicken soup.
Rest, sleep, water, very good. Chicken soup has actually been studied to show that it does help when you're ill.
Pupils fixed and dilated.
Pupils are fixed and dilated. Fixed and dilated means they are not reactive and they're wide open, meaning pretty much no brain function.
Possible subdural hematoma. We need to intubate. Windpipe is crushed. Trach her.
What? One, you don't do it that way. The specific anatomy, your cricothyroid membrane, it is a last resort airway. It is not a first resort airway. What is going on in this office?
Her heart stopped. I'm going in. Maybe she just needs a pick-me-up song. Rib spreader. A doctor's office is a real nice place. A lollipop puts a smile on your face.
What?
Breathe.
Heart stop, do CPR. When you crack open the chest, it has to do with the fact that when somebody loses pulses in penetrating trauma to the chest, but sometimes you can do blunt trauma. It depends on the situation, and you shouldn't be doing this procedure unless you have a surgeon that can then help and fix the patient after you stabilize them.
All in a day's work. Right, kiddo? I want to be an accountant.
This is really weird office medicine. This doesn't happen. Office medicine is preventative and managing chronic illnesses. Emergencies need to go to the emergency department, to a trauma center, where you have specialists like myself, to where we stabilize and then get the patient to the operating rooms, not this debauchery and butchery that occurred in this poor pediatric office. I like this. This is really weird in the sense of like this weird claymation, toy animation thing. They're pretty good. They're using really good terms. They're using good anatomical things and almost accurate medical care. If you guys liked this video, check out this one right here. And as always, subscribe, like the video, hit your bell notifications, and thank you so much for watching. Stay healthy, my friends.